Hello, good evening, and good afternoon. Thank you for watching this video. For my signature assignment for NUR 645, I will be doing this short video for 15 minutes. So for NUR 643 and 645, I had two preceptors, and I'm going to start by talking about Lisa, the psychotherapy non-prescribing on psychotherapy that I use. And then I'm going to talk about Dr. Gea Elvis. That was the main preceptor for my practicum complex chronic um, psycho um, mental illness diseases. So Lisa is a MSW social worker counselor with um, Kaiser Permanente, and I spent over 100 and something hours with her at the clinic, even though the patients were tele by video calls, and we had a few patients, about four, that made it face to face. Lisa practices in an integrative care setting. We have primary care physicians and other um, um, disciplines, and with their offices in the same place, pediatric, family care, and so she has her own office. And we saw an average of 5 to 6 patients a day. We had three crisis intervention patients with high risk for suicide. They actually had a plan, so we had to send them to the hospital. And I learned quite a lot from Lisa. She's very knowledgeable in what she was doing and very versed in, very confident. She calls herself the guru of CBT. She has all these books about CBT, and but most of the patients that came in had an exacerbation in the anxiety, depression, grief, um, uh, loss of loved ones, job anxiety at work, anxiety because of the virus, anxiety with disabled children, spouses. So that range of complications and issues that cause a whole lot of anxiety, and they needing counseling. There's one patient that came in and actually had a plan for suicide, to kill herself from loneliness and not really having any family member around her. So Lisa, based on three therapy modalities, on CBT, on DBT, she used ACT. Yes, those were the three main modalities that we use. A lot of mindfulness, a lot of validation and acceptance, and a lot of stop and living in the moment. A lot of accepting and moving away from your grief, with people, those patients that were grieving the loss of their work or family member, or a lot of them with guilt. So that was the range of patients that we saw. It was mostly shared because of the video call. I never get to interview a patient by myself, so Lisa was always there. But the discussion that we had about patients was really intense, and I learned quite a lot. And she gave me a lot of materials to study after that. And so when a patient would come in, and then the patient would narrate that why they're there, either for follow-up or initial patient, and then Lisa will ask me to kind of what modality you're going to use in that situation. A lot of meditation, and a lot of deep breathing exercises for a lot of people with panic attack and anxiety, for that instance. Yeah, so I learned quite a lot with Lisa. And my next, I am going to talk about And yes, coding. We did a lot of the ICD code, almost mirroring the mental health coding, and even the CPT codes and the billing codes are almost the same. Um, for the 99214 for the billing, and a lot of 99203, 99204, 99205 that we use. And I saw that we use the same code also with Dr. Evis Gaya. So I'm going to talk about Dr. Evis Gaya. Dr. Evis is psychiatry mental health family nurse practitioner, psychiatry mental health, board certified, family nurse practitioner, board certified. He runs his own clinic, and both as a psychiatry mental health and a family nurse practitioner. And I cannot say he so knowledgeable, and the way he interacted with his patients, giving me confidence to get out there, how he got his patients involved in the care. Patients, when they come in, he let them explain what the medications they're taking, how they've been taking it, and how it's been working for them, effective and not effective. And then he actually let the patients take part in their own in the decision making of what medications to change, and not change, how to when to order labs and when to order urine tests for patients that are taking certain drugs and certain medications, when he ordered labs, and actually went over a lot of neurotransmitters, why he's prescribing certain medications to target a certain neurotransmitter and not certain medications. And with him too, we saw a lot of patients with anxiety, a lot of patients with depression, moderate, severe, some patients with PTSD, ADHD, mostly for the younger ones. And I think that I would have loved to have more experience with the pediatrics. We had quite a few that we saw, but I wanted to have more on that. And yes, I still want to be a psychiatric mental health nurse practitioner. Yes, I think that I have a lot to offer. Being in the field and being a strong patient advocate, I really want to affect policies. Having situations where patients cannot advocate for themselves, I want to be in that position where I can advocate for my patients in terms of medication coverage, insurance coverage, and be able to affect policies for my patients. So I think I have a lot to contribute. Being a hospice nurse, the compassion, I can understand and connect with my patients. But at the same time, where I am right now, I think there's a lot I need to learn, a lot of material. When I think about it, I'm like, there's so much I still need to read, there's so much I still need to know, there's a lot to be read. And I don't feel like I'm well prepared. But who knows? Maybe once I get in the field and start working and get experience working with other experienced nurse practitioners, and then I can, who knows? But right now, I am nervous. Yes, I'm not gonna say I'm 100% confident. I am nervous because I don't know what to expect. I don't know what to expect. I don't want to make mistakes and order the wrong medication or misdiagnose somebody. Those questions pop in my mind and I think about them. But I think I made the right decision doing this doctor's degree. It's the right decision when I see what's going on. And how different. I know when I finish psychotherapy with Lisa and I will go to work, I've been implementing it with my patients, talking more about relaxation and being mindful, and special patients that are so anxious, and to take a moment and stop and think, use a stop sign. I cannot really go into details with giving patients advice because I'm not practicing. as a psychotherapy, but um, I could I see myself, listening to patients now, and validating their feelings and validating their complaints and patients like that. And um, I have had to hold myself back not to give patients any medical advice, especially patients that come in with psychotic symptoms, patients that come with behavior, and they're going through anxiety and depression. What I do is give my suggestions and a proposal to the MD to make a decision. I'm being very careful not to start giving patients advice, because I've been tempted so many times to, like, why is this patient taking Ativan? Why is this patient taking this medication? And I think it's because of the knowledge that I have gained doing the NUI 643 and 645. And so I have to be mindful myself not to be giving patients advice when I'm not credentialed yet, and and not my patient. So I have to be mindful of that. I do worry about insurance coverage. I do worry about payment. I do worry about where I will work and what population I want to serve. But I know that I'm looking at working with Kaiser Permanente in that behavioral health clinic. They have vacancy over there. I'm already an employee with Kaiser, so I have a chance of being employed at that clinic right now where they have vacancy. And I am just hoping to be my best and to represent Bradman in the best possible way. Yes. I hope I'm not leaving anything else. So I have talked about Lisa. She was in an integrative care setting, but Dr. Ngea owned his own clinic. And the downside to me and Dr. Ngea was that he is in Texas and I'm here. It was the telepsych. I would have loved a face-to-face interaction like I had with Lisa, where we sat face-to-face, and when she's explaining things to me, it makes a whole lot of sense. Dr. Ngea, we always had to meet after in the waiting room, and then after we see a patient to go over the rationale and or medication explanation and ask my own question. That was the disconnect, and because of COVID, we did the best that we could in that scenario, in that situation, because all of my clinics here were not taking students anymore, and that was the only downside and the only disadvantage of this experience. But otherwise, I learned a lot from these two preceptors, and yes, I will recommend them to any student that want to be precept. Yes, they are patient. They want to see you learn. They want to see you grow. They're not just there for you to put in your hours and leave. They want to make sure that you come out knowledgeable and impacted. And I will recommend them anytime for anyone that wants to be precepted. So, Dr. Ngea Evis, Texas Family Practice and Mental Health Clinic. And Lisa is here with Kaiser Permanente at the Puyallup Clinic, the two of them. It was a great experience overall. I think I have mentioned this, that we need more hours. We need more clinical hours. That I that's my opinion, that we need more clinical hours. What we're doing right now, it's okay, but if we could get more clinical hours to build that confidence, that would be great. That would be great. Alrighty, I think I covered all the aspects for the signature paper. Thank you for listening, and thank you, and it was a great experience, and hoping to go out there and be the best, and be the best and affect patients' life and change the world of nursing for the better. Thank you.